So yes, good evening. Yes. So yes, good evening, everyone. Happy Holi to everyone present over here. Happy Holi, guys. So yes, Mudassir, Mohabbati, Sneha, Jia, Vedant, Amreen, Zohra, Jibimi. Good evening, guys. I hope you all are doing good at your end. Yeah. So today we are going to discuss all the 206 bones of our body, 206 bones of our body. So before starting that, just give me a thumbs up in the chat box if the audio and visuals are perfectly clear, guys. So let me know, yes, if the audio and visuals are perfectly clear, just give me a thumbs up in the chat box. And yes, today is a very important session. I will be discussing all these, yeah. So yes, I'm just waiting for your thumbs up, guys. So just let me know. Hmm. Hmm. Yes. Jura, okay, good evening, George. Yes, Sneha. Yes. Jibimi, Jia, virtual reality, Jura, Sneha, Rehman, Zara. Okay. Anzal, Saurav, Hina. Very good. Very good. I hope it's clear. So let's start with the topic without wasting much more time. Let's start with the topic. Yes. Now the skeletal system, guys, you guys already know. Okay, the skeleton contains all the bones that are present in the body. Can anyone tell me how many bones are present in the adult? Osama, good evening. Yes, gross anatomy also, Firoz. Hansraj, yes, hi. So you guys already know the total number of bones present in our body. Okay, that is 206 bones, right? 206 bones in the adults. 206 bones in the adults, right? These 206 bones, yes, Osama, very good. Yes, these 206 bones, they are basically divided into two categories, guys. They are basically divided into two categories, guys. Yes, we have the axial skeleton bones, the axial skeleton bones, and we have the appendicular skeleton bones. We have the appendicular skeleton bones, right? Yes, we have the axial skeleton bones and we have the appendicular skeleton bones. Now, what is meant by the axial skeleton? Guys, firstly, you have to remember, yes, guys, firstly, you have to remember that the axial skeleton basically consists of 80 bones, right? The axial skeletal basically consists of 80 bones, and these are the bones of head, trunk. Okay, now axial skeletons are basically the bones of the head and the trunk. Okay, head and the trunk, head and the trunk. Yes, Dr. Ishan, thank you so very much for this. Naveen, thank you guys so very much. Yeah. So axial skeleton basically they are having 80 bones, right? And they are the bones of the head and the trunk. Now, guys, I will be teaching you each bone independently, so not to worry. Today we will just learn the names. See, this is general anatomy. First, you should know all the 206 bones in our body and where they are located, guys. Okay, so today I will be teaching you all the 206 bones. So be with me throughout the lecture, okay? And I'm guaranteeing you after this it will again form the basis, the foundation, okay, for the upcoming lectures, right? Now, guys, the very first thing in the axial skeleton, yes, the very first thing in the axial skeleton, guys, you already know. In the head part, guys, you already know we have the skull. We have the skull. And remember, the skull bones are divided into two categories, guys. The skull bones are divided into two categories. We have the cranium part, we have the cranium part, and we have the facial bones. We have the facial bones. Remember, guys, the cranium basically it consists of 8 bones. The facial bones are 14 in number. I will be teaching all the cranium bones in the next slide. So absolutely no need to worry if you don't know anything. Just remember we have the skull, right? In the skull, we have the cranium part and the facial part. The cranium bone basically they are 8 in number and the facial bones they are 14 in number. They are 14 in number. Now guys, I want to ask you I want to ask you guys, there is a bone that is present in the neck region. There is only one bone that is present in the neck region. Can anyone tell me the name of that particular bone? Yes. Now, guys, before that, I skipped this part, but I wanted to tell you, axials means basically the midline, the bones which are present along the midline of the body. Okay, the median plane. Okay, the median or the mid axis of the body or around the mid axis of the body. Yes, yes, Osama, Jebimi, Hina, Zara, virtual reality. Very good. And appendicular basically means the extremities, like the upper limb and the lower limb, right? Okay, so just remember, guys, axial means the midline bones or the bones which are surrounding the midline, right? So we have the skull, we have the facial bones, and in the neck, guys, we have the hyoid bone, as said by everyone. George, we have very good, very good. So, yes, we have one bone that is present in the neck region. That is the hyoid bone. That is the hyoid bone. And hyoid bone, it is again one in number. It is again one in number. Now, guys, now ear is basically divided into three categories. The ear, it is basically divided into three categories, guys. Oh, three categories. I'm saying three parts. So you already know the ear has three parts, right? We have the external ear, right? We have the external ear, the middle ear, and the inner ear. The inner ear. So you guys already know the middle ear. The middle ear basically will contain three bones, guys, right? The three bones present in the middle ear. Can anyone tell me the name of those three bones that are present in the middle ear? Yes, can anyone tell me the name of the three bones that are present in the middle ear? Yes. ईयर के अंदर तीन बोन्स होते हैं. I want the names of that three bones. That is a very basic question, guys. And these bones are basically yes, these are yes. Johra, very good. Hall of Study, very good. Jemimi, very good, beta. Yes, Sai Teja S, very good, guys. Yes. So you guys already know we have the ear ossicles. Ear ossicles. Ossicles basically means the tiny bones, guys, right? They are basically three in number. So in totality, it is six, and you guys know that it is three for the right ear and three for the left ear. Three for the right ear and three for the left ear. Yes, Osama, very good. You guys already know this? Yes. Hmm. Now, you guys already know this ear ossicles. We have the malleus, incus, and stapes. MIS. You guys already know the full form, I suppose. The malleus, incus, and stapes. We will see the pictures also. Absolutely, guys, no need to worry. I will teach you everything, right? We will discuss the joints also because in latest NEET PG exam they have asked a joint from this particular three bones, right? So yes, I will be coming to all this as well. But as of now, remember there are three ossicles on the right side, three on the left. I mean in the left ear, right? In the middle ear, right? Apart from that, guys, you have to remember the bones of the thorax, guys, the thoracic cage, or let me write it with the blue color only. The bones of the thoracic cage, guys. The thoracic cage, right? The thorax. Now, you guys already know the thoracic cage. Basically, it comprises of the ribs and it also comprises of the sternum. Now you guys are going to tell me how many ribs are there. How many ribs are there? You guys are going to tell me how many ribs are there, guys. So yes, this is a very basic question and I want every one of you to answer it. Yes. 12 pairs. Yes, Osama, Sabrina, Naveen, George. Very good. It is approximate. It is 24, right? It is 24. Yes, it is 24. Hmm? Okay. Now, yes, we also have, yes, I'm just writing it over here, but I will be discussing that. Yeah, we also have the vertebra. And can anyone tell me, Ansel, Surya, Hina, Jibimi? Very good. Yes, can anyone tell me the number of the vertebra present in the body? The adult vertebra number. It is how much, guys? The vertebras, right? Can anyone tell me? Yeah. Yes, Sarah Aftab, very good. It is 26 in number, guys. It is 26 in number. Sure. Very good. So let us discuss one by one all the bones, okay, of the axial skeleton. I will be focusing on all the bones of the axial skeleton now, right? All the 80 bones I will be discussing one by one. Yes, Osama, right. So, firstly, I will be discussing the bones of the skull, right? The cranium. Okay. So, yes, the cranium and the facial bones. So, please put the heading as the axial skeleton. In the axial skeleton, we are going to discuss the bones of the cranium, okay, and the facial bones, okay, and the facial bones. Now, guys, you already know the cranium bones are basically 8 in number, okay. The cranium, or it is also called as the calvaria. It is also called as the calvaria, right? These bones are 8 in number. These bones are 8 in number. These bones are 8 in number. Now, guys, try to see over here. Try to see over here. You guys already know we have, yes, the very first one that we are going to discuss that is present just over here, that is called as the frontal bone, guys. That is called as the frontal bone. That is called as the frontal bone, guys, right? So now you guys are going to tell me this is which view. I'm giving you 4 options. You have to comment in the chat box: anterior, posterior, lateral, or yeah, which view is this, guys? You're watching the skull from where? Anterior, posterior, lateral. Yes, Sarah, George, Sabrina, very good. It is the anterior view, guys. Very, very, very important. Yeah, this is the anterior view. This is the anterior view. Now, you're watching the skull from front, right? Now, guys, you will see over here, this bone that I am highlighting over here, this is called as the frontal bone. This is called as the frontal bone. Yeah, just, yeah. This is called, yes, everyone is right. This is called as the frontal bone. Now, can anyone tell me how many frontal bones are present in the body? Yes, it is one only, the frontal bone. So we'll make a list one by one. One by one, I will show you everything and we will make the list. Try to learn along with me, guys. Try to learn along with me. Try to make a list and try to learn along with me, right? So we have the frontal bone, right? We have the frontal bone, and remember this frontal bone, it is 1 in number. It is 1 in number, right? Now coming on to the next bone, that is the temporal bone. Okay, that is the temporal bone. Now this is the view of the skull, guys. Now you guys will tell me you are watching the skull from front, from behind, or from the lateral side. You guys are going to tell me, Naveen, yes. You guys are going to tell me you are watching the skull from where? The temporal bone. Yes. Yes, Vijora, very good. Sabrina, Osama, Hina, Kausar, very good. This is the lateral view, guys. You're watching the skull from the side. Okay, the side view. Okay, the side view, guys. The side view. Now, guys, you can automatically see that there is a hole over here. Okay, that is the hole of the ear. So this bone is just present above this ear, right? So that is actually called as the temporal bone, right? So this is the temporal bone. Now guys, use your brains and tell me how many temporal bones will be there in our body. How many temporal bones will be there in the body? Yes, the temporal bones. Obviously, George, very good. It is two in number. Osama Hina Jura, very good. It is two in number. It is two in number. Now the third one, guys, the third one, that is the parietal bone. That is the parietal bone, guys. That is the parietal bone. Now, guys, you already have heard the term of pari. Now, pari wears a crown over here, right? The crown over here. So obviously, we have the parietal bones, guys. We have the parietal bones. Yes, remember, Naveen, okay. Anjal, okay, welcome to the session. Yes, the parietal bones, guys. The parietal bones are situated, okay, just above, right? And remember, beta, we have two parietal bones. If you just want to see, you can see we have the parietal bones. We have the parietal bone. The parietal bone. Now, guys, you are going to tell me which view is this? Which view is this? You are going to tell me this is left. Okay, you guys are going to tell me which view is this, guys. You guys are going to tell me whether this is left or whether this is right. Right or left. Use your brains and just tell me, guys. I want you guys to answer this. Yes, you're watching the skull from behind, guys. Right? This is the posterior view. Yes, Jessely Jhora, Usama, very good. This is the posterior view, guys. This is the posterior view, right? Now, in the posterior view, this side will be the right. Yes, very good. We have to decide everything with respect to the patient or the cadaver, right? Yes, and B is the left wala part. Yes, B is the left wala part. So we have two parietal bones, guys. We have two parietal bones, the left and the right parietal bone. So please just try to mention in the chart. Yeah, we have two parietal bones. We have two parietal bones. We have two parietal bones, right? After that, after that, guys, we have one bone which is situated behind, which is posteriorly present, and that is called as occipital bone. Occipital bone. Occipital bone, and remember, occipital bone is one in number. Occipital bone is one in number. Occipital bone is one in number. So you can just see it over here, guys. Yes. Yes, this blue colored bone, this is the occipital bone. This is the occipital bone. And you can see that the occipital bone, it is present posteriorly. It is present posteriorly. Yes, yes, it is one in number. It is one in number, right? Two parietal, one frontal, one occipital, two temporal. I hope till now everything is clear. So just give me a thumbs up in the chat box if this is clear to each one of you, right? So occipital, we have done 6 bones. Check. Now coming on to the next one, since there are 8 in number, the two bones which are left, guys. Yes, one, it is the ethmoid bone and sphenoid bone. So one, you can see we have the sphenoid bone, right? The sphenoid bone. Yes, I will come to the sutures, Naveen, when I will discuss the joints fall apart. As of now, I'm just teaching the names of the bones. Okay, this is general anatomy class. So yeah, I will be teaching the names and all the sutures we will be discussing in the joints part. Okay? Sure. Now, the sphenoid bone, guys, if you can just see, just next to the temporal, you can see the sphenoid bone over here, right? So this is the sphenoid bone. If you just want to see, you can see this image as well. Yes, this is the sphenoid bone. Yes, I will be teaching all the bones when I will be discussing the head and the neck anatomy. Each bone I will teach you in detail. Each bone I will teach you in detail. Just remember, yes, we have the sphenoid bone and it is one in number. It is one in number. It is one in number. Apart from that, guys, remember we have one ethmoid bone also. We have one ethmoid bone also. We have one ethmoid bone also. So you can see one ethmoid bone over here, the green colored bone over here. Yes. And more clearly, if you want to see, yes, you can just see over here. Yes, this is the ethmoid bone. Okay, this is the ethmoid bone. Hmm. So I hope till now it is clear to each one of you. Just give me a thumbs up that all the cranium bones are clear to you. All the cranium bones are clear to you guys. So be with me guys, everyone. Yes, we have discussed 8 bones out of 206 bones. We have covered 8 bones. Sure, Zara, Jeremy, Sabrina, very good. What about rest, guys? Sure. Now we will be studying about the facial bones. Now we have already covered the cranium bones, right? We have covered the cranium bones that are 8 in number. Now we are going to discuss the facial bones. Now we are going to discuss the facial bones. Yes. Now, okay. Mhm. Okay, I have space over here. I'll write it over here. Yes. So let us now discuss about the facial bones. Now, you guys already know the facial bones, they are 14 in number. The facial bones, they are 14 in number. They are 14 in number, guys. They are 14 in number. Now, starting up from the very basic facial bone, right? That is the nasal bones. Everyone, put your fingers on the nose, right? You can feel a bony structure over here. So we have 2 nasal bones, guys. Try to be very clear with this. You can all see this nasal bone, right? Which I'm just marking the boundary. Yes, we have the nasal bone. Okay. Now, the one which I've highlighted, guys, you guys are going to tell me it is the right nasal bone or the left nasal bone. Chalo, let me test your presence. It is the right nasal bone or the left nasal bone. Now, this we have the nasal bones, and you can see over here. Yes, this is the nasal bones, right? Yes, the left nasal bone, because you already know this is the right side and this is the left side. According to the anatomical position, this is the left side, right? So this is the right nasal bone and the left nasal bone. The right nasal bone and the left nasal bone. Yes, everyone is right. Everyone is right. I can see everyone commenting. Please comment everyone, right? So we have 2 nasal bones. So remember, making the list, yes, we have the nasal bones, and these nasal bones are again 2 in number, the right and the left nasal bones. The right and the left nasal bones. Now, guys, coming on to the next bone, that is the zygomatic bone, right? Zygomatic bone. Hina Passer, yes, it is right. Zygomatic bone. You guys are going to tell me the other name for the zygomatic bone. In commonly, what we call it as the zygomatic bone. The zygomatic bone. And you can see, yes, the zygomatic bone. Zygomatic bone. So we have the right zygomatic bone and the left zygomatic bone. So it is automatically clear. Yes, Sabrina, very good. Zara, very good. Johraz, Jemime, very good, guys. We have the 2 zygomatic bones, guys. We have the 2 zygomatic bones. Yes, we have the 2 zygomatic bones, and remember, it is the cheek wala bone. Yes, the right and the left zygomatic bones, right? So zygomatic bones are also called as the cheek bones. They are also called as the cheek bones. Now, guys, the very common wala, this purple wala, which bone is this, guys? This one. It's very simple. You guys already know this. Can anyone tell me? Yeah. Hmm. Yes, JBM, very good. It is the maxilla, guys. It is the maxilla. It is the maxilla, right? The maxilla. It is also called as the upper jaw, right? It forms the upper jaw, right? It is the maxilla, guys. And maxilla is also 2 in number. Maxilla is also 2 in number. We have the left maxilla. We have the left maxilla. Let me write it with other pen so that it's clear. Yes, we have, yeah, the two maxilla, the left maxilla and the right maxilla. Right maxilla. So we have two maxilla guys over here. We have two maxilla, and remember the maxilla is also two in number. The maxilla is also two in number. Now coming on to the next bone guys. Below the maxilla, the one which forms the lower jaw. Can anyone tell me the name of this wala bone? The lower jaw of your face, right? The lower jaw of your face. Chalo chalo, comment guys. Very good, Sabrina. I think you guys are like awesome. So this is the mandible guys. This is the mandible. Be very clear with the markings guys, because this is anyway going to help you. The mandible, it is the lower jaw, right? The mandible, it is the lower jaw. And remember, it is one in number. The mandible, it is the lower jaw and it is one in number, right? Yes. Now guys, sure, very good guys. Now, there is one bone guys that okay, let me this is the mandible guys, right? Now guys, remember that there are palatine bones, right? There are they are deep inside, right? Over you can see the palates, they form the palates. So basically we have the two palatine bones guys. We have the two palatine bones, right? We have the two palatine bones. So yes, just try to write it there as well. We have the two palatine bones, right? We'll be discussing all the bones in detail, but as of now, just remember the two palatine bones are there. Okay. Yes, yes, Mudassir. I will continue, guys. Absolutely no need to worry. I'm just teaching the names right now. Once you're clear with the names and the location, so it will be more clear okay, how the 206 bones goes on, right? So yes. Now we have the two lacrimal bones, guys. Lacrimal. What is meant by the lacrimal? कहाँ पे सुना हुआ है lacrimal? Have you heard the term lacrimal somewhere? Yes. It will again give you a hint where this bone is present. Yes, Thorax Sanju, you're right. Have you heard the term lacrimal? Chalo. Hmm. Yes, have you heard the term lacrimal? Yes, we have. Yes, below the nasal, you can see over here, we have the lacrimal bones, right? We have the lacrimal bones. Yes, lacrimal glands सुने होंगे सब लोगों ने. Yes, which are carrying all the secretions from the eyes, right? The lacrimal glands. So yes, virtual reality, very good. So it is just present over there, right? Yes, eyes, very good, very good. The two lacrimal bones. Yes, now, now guys, there is one bone that you have to learn as of now. That is the inferior nasal concha. Inferior nasal concha or CONCHAE. Yes, yes. Everyone is right, guys. The two inferior nasal concha are there, right? We have the two nose, so we have the two inferior nasal concha, and yes, the ducts, the हाँ बिल्कुल ठीक है स्नेहा. And one bone that we have to remember, guys, that is the vomer bone. Okay, yes, the sphenoid and the vomer will form a joint. I will be talking about that joint also. Yes, so as of now, remember we have one vomer bone. We have one vomer bone. Inferior nasal concha 2, and we have one vomer bone, right? Yes. So you can see that over here, the vomer bone is there, the inferior nasal concha, and this vomer bone, it is present in the nasal part, right? So we have the inferior nasal concha and the vomer bone as well, right? Yes, below the nasal parts. Yes, below the nasal concas. Yeah, we have the this part, right? Hmm. Sure. I hope this is clear. I hope this is clear to everyone. All the 14 bones. Let's count it. The 2 nasal, 2 plus 2, 4, 4 plus 2, 6, 7, 8, 9, 10, 11, 12, 13, and 14. All the facial 14 bones are done, guys. Just give me a thumbs up, guys, in the chat box if you are done with this. Roop Singh, Meena, Jibimi, very good. What about rest, guys? Are you all done with this? Please give me a thumbs up in the chat box. Huh. Sure. Very good. Zara, Sabrina. So all the facial bones are done. Sure. Now, so 14 plus 8, how many bones we have done now? We have already covered how many bones now? 14 plus 8, it is how many, guys? You guys are going to write the number 14 plus 8, how many it is? Yes, Roop Singh, Meena, very good. We have covered 22 bones out of 206. Gaurav, Yuvraj, Sabrina, Hina, Usama, very good. Now, guys, so moving on to the next one. Before that, just try to comment the bone marked with A in the lateral view, and guys, just try to mark the bone B, which is present over here. Just let me know if you can name these bones. Yes, Sabrina, very good. It is the occipital bone. Perfect. Yes, Osama, Jimmy, Georgia. Yes, Sabrina, the next one is also right. That is the zygomatic wala part. Zygomatic wala part, right? The zygomatic bone. The cheekbone. Yes. Everyone is right. Very good. Hina Kausar, very good. George. Okay. Now we have already covered the facial bone. We have already covered the cranium bones. Now coming on to the next one, guys. Yes. Now coming on to the vertebral column, guys. Coming on to the vertebral column. Now, you guys already know in adults, right? In adults, we have 26 vertebra. Okay, we have 26 vertebrae. Okay, let us first write down all the names, right? Let us first write down all the names. We have the cervical vertebra, the thoracic vertebra, the lumbar vertebra, sacral vertebra, and the coccygeal vertebrae, right? Now, in adults, guys, you already know we have 7 cervical vertebra, 12 thoracic vertebra, 5 lumbar vertebra, 1 sacral vertebra, and 1 coccygeal vertebra. Again, guys, be very clear with the terminology. I'm talking about the adults, guys, right? The sacral vertebra, it is fused to form one single bone, right? Now, if okay, someone is saying, so let's just pen down in children's also, guys. If in the newborns, if you will ask me, in the newborns, if you will ask me, guys, we have 33 vertebra. We have 33 vertebra in the newborns. Now, how does it differ? The cervical vertebra, it is 7, it is 12, right? It is 5. The sacral vertebra, it is also 5 in the newborn, and comparatively the coccyx, it is 4. It can be 3 or 4. Okay, so as of now, remember the newborns are having 33 vertebra, but later on, all the coccygeal vertebra and all the sacral vertebra, they are fused to form one vertebra. They are fused to form one vertebra. They are fused to form one vertebra, right? So I hope you got the concept. So just try to see it over here. You can very well see that this is the occipital bone. This is the occipital bone, and this is the posterior view, guys. This is the posterior view, and all the vertebrae are present posteriorly. I hope you all agree with the statement. These all vertebrae are present posteriorly. In the neck region, we have the cervical vertebra. सर्वाइकल वर्टिब्रा कहते हैं ना सर्वाइकल की प्रॉब्लम हो गई है. It is we are talking about the neck region, guys, right? We have the cervical vertebra in the neck region. Then coming on to the thorax wala part. In thorax, I have already told you thorax is a region between the neck and the abdomen. Now in the thoracic part, you guys, we have the thoracic cage. Thoracic cage, it is composed of the vertebra ribs and the sternum, right? Vertebra, ribs and the sternum. So the thoracic wala part will have how many vertebra? You already know. We have the 12 thoracic vertebra. Then in the abdominal part, guys, you already know we have the lumbar vertebra. We have the lumbar vertebra. Then we have sacrum and then we have coccyx. Okay. So seventh cervical, thoracic, thorax के नीचे abdominal आ गया. Abdominal, posterior side abdominal part basically will have a vertebra, that is the lumbar vertebra. Then we have sacral vertebra and then we have coccygeal vertebra. So yes guys, I hope this is clear. All the 26 vertebrae are clear. All the 26 vertebrae are clear to all of you. Just give me a thumbs up if all the 26 vertebrae are clear to all of you. Yes. So yes, Roop Singh, Meena, very good. Ina, Sabrina, Jimmy, Saurav, perfect, perfect guys. Very good, very good. Ajala, very good. Sure. Perfect, perfect. You guys are rocking. Just be with me, be with the flow. I will teach you all the bones on hand. No, just the namings, right? As soon as we cover the different parts, I'm teaching the neck. First, I'll start with the cervical vertebra only. I will teach you everything. Single bone, I will teach you. No need to worry. As of now, in general part, try to learn the general things, right? Now, I'm telling you, if you guys will be with me, no one will teach you the bones. I will be the first one to teach you bones live, right? So, every day 10 p.m. ये हो गया. Now, we have already covered 26 plus 22 bones, right? Now coming on to the thorax wala part. Okay, the thorax wala part. You guys already know this bone. It is called as the sternum. The sternum, right? The sternum. Now, sternum, it is how many, guys? Sternum, it is how many? The sternum, it is only one. The sternum, it is only one, right? Now, apart from that, we have the ribs. Okay, we have the ribs. Now, guys, you already know the ribs. Okay. Now, this blue color, firstly, please try to understand the difference. This blue color is not the rib. This blue color which I'm highlighting over here, beta, this blue color, it is the costal cartilage. It is the costal cartilage, guys. It is the costal cartilage. Yes, it is the costal cartilage, right? I will coming to the parts, everything. This is the costal cartilage. And to the costal cartilage, this wala part. Yes, this green color wala part, this is the rib, guys. This is the rib. So this is called as the costal rib. Costal ribs. We have the costal cartilage and we have the costal ribs. We have the costal ribs. Now, guys, be very clear with the term. The costal cartilage, they are not bones, but again, you have to remember they are also 12 in number. Now, you will say that we can see okay. Now, first, at least let's talk about the ribs. You guys already know the ribs basically are 12 pairs. Now, when I say 12 pairs, it is 12 plus 12, that is 24. 12 plus 12, that is 24, right? Now, guys, you can see that we have the, okay, let me use this pen. Yeah, we have the first rib, the second, the third, fourth, fifth, sixth, seventh, eighth, ninth, 10th. And we have two ribs over here, 11th and 12th. Now, guys, you can very well see that, yes, the ribs are divided into true ribs, right? Now, the true ribs are the ones which are directly attached to the sternum. Directly attached to sternum with the help of their costal cartilage. Can you make out how many ribs are directly attached to the sternum? Yes, Shakil, daily classes there. You can see the previous videos. They are over here. The notes are already uploaded in the Telegram group. Okay, the notes, the Telegram group is also mentioned in the chat. Yes. Now, guys, if you can see, guys, over here, the first rib, it is attaching directly, the second rib, the third rib, the fourth rib, the fifth rib, the sixth rib, and even the seventh rib, it is attached directly to the sternum, right? Now, so first to seventh rib, Okay, first to 7 ribs are basically the true ribs. Yes, then you already know we have 8, 9, and 10. If you can just see the 8, 9, and 10, their costal cartilage are attached to which costal cartilage? 7th costal cartilage. Okay, so the 8th, 9th, and 10th basically they are attached to 7th rib. They are attached to 7th rib, right? They are attached to 7th rib, right? And guys, if you can see 11th and 12th, they are now 11th and 12th are basically called as the floating ribs. 11th and 12th are basically called as the floating ribs. Now, the reason why they are called as the floating ribs because they are coming from behind, but they are not joining the sternum from front. They are floating in the abdomen, guys. They are floating in the abdomen. So they are the floating ribs. So we have already discussed these 25 bones over here. We have already discussed this 25 bones over here. 12 ribs, 1 sternum. Thorax, we are done with 25 bones. We are done with 25 bones of the thorax. So let us just try to um, yes, let us just try to make the list. In the axial skeleton, guys, in the axial skeleton, you guys already know the skull bones. Yes, the cranium and the facial bones. The cranium and the facial bones, guys. Yes, the cranium bones basically they are 8. The facial bones they are 14. Then we have vertebra. Vertebra you already know it is 26. Then we have thoracic wala part in which we have discussed the ribs and the sternum. The ribs it is 24, the sternum it is 1. Now you guys have also started about the hyoid bone, right? The hyoid bone it is present in the neck region, it is 1 in number, right? Now we have the ear ossicles. No, I've told you axial means in the midline or one which is surrounding the midline. That is the part of the axial skeleton. The ear ossicles they are 6 in number, 3 in the left, 3 in the right ear, and 3 in the left ear, right? Malleus incusstates here, malleus incusstates there. Now, yes, you guys are now going to count and tell me are the 80 bones done or not? I'm waiting for your answers, guys. Yes, are the 80 bones done or not? Yes. चल फटाफट जल्दी से. Yes. One, guys. Tell me, guys. Hmm. चल. Okay. Perfect, guys. हो गया? So we have already discussed all these hyoid, thoracic cage वाले सारे bones हो गए. Now we have already covered these 80 bones in detail. Now starting with the next one. Yes. That is the appendicular skeleton, guys. That is the appendicular skeleton. Not. Okay, which one is left? Tell me, guys, now. Hmm. You guys are going to point out now. Sure. Now, appendicular skeleton, guys, these are the bones of the extremities, right? These are the bones of the extremities. Extremities, right? These are the bones of the extremities, right? Now, guys, appendicular skeleton is basically divided into the extremities wala bone. We have the pectoral part and we have the upper limb wala part. Now, when I say pectoral, guys, pectoral basically I'm talking to the region which makes the shoulder wala part, the shoulder region actually, the shoulder. Okay, so that is away from the midline, the shoulder wala part, and this upper limb, right? So when I say pectoral girdle, guys, when I say pectoral girdle, okay, I'm talking about the shoulder girdle over here. Specifically, if I just want to point it out, I'm talking about the shoulder girdle over here. I will be teaching you all the bones, guys, over here. Be very clear with this. Yes, I am talking about the shoulder girdle over here. The shoulder girdle over here. Okay, the shoulder girdle. Okay, and the bones of the upper limb. Now guys, just try to look at this. Be very, very clear with the naming of the bones. Yeah, most of you, I know it's first time if you are studying the anatomy, you have to be very clear. Everything we are going to discuss in the normal anatomical position. We are going to discuss in the normal anatomical position, guys, right? Now, firstly, which makes the shoulder, guys? Which makes the shoulder? You guys already know that, yeah, this bone, it is called as the clavicle. It is called as the clavicle. Okay, this is called as the clavicle, guys. This is called as the clavicle, right? Or let me just mark it with some other pen. Yeah, yes. So let me just put the heading, or I can just, yeah, shoulder girdle. This bone, it is the clavicle. Now, the clavicle is also participating in forming the shoulder region. See, clavicle is also the bone of the upper limb, and we call it as the bone of the pectoral girdle or the shoulder girdle because it is forming the shoulder region as well. Now, you guys already know, if I'm talking about the shoulder girdle, guys. So if I'm writing clavicle over here, how many clavicle are present in the body? You guys are going to tell me. And clavicle has some other names as well. Yes, you are right. Yes, Sabrina, you are right, guys. Clavicle is also known as the collarbone, right? It is also known as, yeah, the collarbone. Yes, yes, yes. Everyone is right. Yes. It is also known as the collarbone, or it is also known as the beauty bone of the body. And you guys remember that there are two clavicles which are present. There are two clavicles which are present, right? There are two clavicles which are present, one for the right side and one for the left side, right? One for the right side and one for the left side. Okay. Now, again, guys, you have to be very clear over here that clavicle, it is the anterior bone. क्लेविकल आगे की तरफ प्रेजेंट होता है क्लेविकल इज नॉट प्रेजेंट बिहाइंड गाइस क्लेविकल इज इन फ्रंट यू कैन टच योर ओन क्लेविकल एंड फील इट थ्रू आउट इट इज subcutaneous throughout it is the only bone which is subcutaneous you can feel it under the skin throughout so remember guys that this particular bone it is yes it is the collarbone or the beauty bone and remember it is the anterior bone of the shoulder girdle it is the anterior bone of the shoulder girdle right? It is the anterior bone of the shoulder girdle. It is the anterior bone of the shoulder girdle. Now, apart from that, guys, you can see a triangular bone over here. A triangular bone over here, guys, right? A triangular bone over here. This triangular bone, this flat triangular bone, which is present behind, right? This is called as the scapula. This is called as the scapula. Okay, this is called as the scapula, guys, right? This is called, yes, this is called as the scapula. So remember, in the shoulder girdle, which is forming the shoulder region, guys, we have the scapula. And scapula, it is also called as the shoulder blade, right? It is also called as the shoulder blade. And remember, guys, that it is the posterior bone of the shoulder girdle. Okay, posterior means it is present behind. ये पीछे की तरफ होता है. It is present behind, guys. So remember, yes, it is the posterior bone of the shoulder girdle. It is the posterior bone of the shoulder girdle, right? So scapula, it is the shoulder blade, the posterior bone of the shoulder girdle, right? And remember, the scapula is also two in number. It is also two in number, one for the right side and one for the left side. So we have two scapula, right and the left scapula, the right and the left scapula. Now, guys, coming on to the next bone over here, coming on to the next bone over here. Now, this bone. Now, this is a part of the shoulder region also, or this is exactly a part of the upper limb also. It is correct both ways, right? You can write it in shoulder girdle as well. You can write it in upper limb also. I'm writing it over here. Yes, This bone, it is called as the humerus. This is the humerus. Can anyone tell me this humerus, it is present in which region, guys? This humerus, it is present in which region? Yes, Sabrina, very good. It is the bone of the arm region. It is the bone of the arm region. Yes, yes, guys, you're right. This is the humerus. Yes. And remember, the humerus bone, it is basically the bone of the upper arm, right? It is the bone of the upper arm, bone of the upper arm. And remember, this is also two in number. This is also two in number, one for the right side and one for the left side, right? Right? So that was about the shoulder part. You can see that these three are actually forming the shoulder region. These three are actually forming the shoulder region. That's why it is the part of the appendicular skeleton, the pectoral girdle. Apart from that, guys, you already know that this is the arm wala part. This is the arm wala part, or this is also called as brachium. This is also called as the brachium, right? And this is called as the, yes, forearm. This is called as the forearm, or this is also called as the antebrachium. This is also called as antebrachium. This is also called as antebrachium. Now, guys, now, guys, you already know that in the normal anatomical position, that this is the midline of the body. Now, let us assume that this is the midline of the body. This is the midline of the body, right? This is the midline of the body, right? This is the midline of the body. And in the forearm, there are two bones which are present. Now, guys, be very clear with the terms. The bone which is closer to the midline, it is called ulna. And the other bone, it is called as the radius. The other bone, it is called as the radius. So we have two bones, right? So we have ulna, okay, and we have the radius. We have the radius, right? We have the radius. Now, ulna, it is called as, okay, it is closer to the midline. Yes, it is the medial bone of the forearm. It is the medial bone of the forearm because it is lying closer to the midline as compared to radius, right? और ये कौन से region में present है? That is the forearm or the antebrachium. So remember, beta. Yes, Akshay. Hi. So ulna, it is basically the, yeah, the medial bone of the forearm. Medial, why? Because it is closer to the midline of the body in the normal anatomical position. Medial bone of the forearm. And remember that the radius, it is away from the ulna wala part. So it is the lateral bone of the forearm. The lateral bone of the forearm. The lateral bone of the forearm. So ulna, again, beta, remember the ulna, it is 2 in number, and the radius, it is again 2 in number. Ulna, for right ulna and the left ulna, and the right radius and the left radius. The right radius and the left radius. Okay. So you guys are going to count the number of bones that we have discussed on this slide up till now. And you guys are going to, now we are going to discuss in the next slide the bones of the hand. Very, very important. The bones of the hand. Very, very important. In the next slide, I will teach you with the help of a diagram. Yes. So I hope this is clear to everyone over here. Yes. Yes, Saurabh Sanju, very good. It is 10. The 10 bones, again, we have done 90 bones up till now. Yes, everyone is right. Ajala, Roop Singh, Meena, very good, guys. So we have already covered these 10 bones, right? The 2, 2, 2, 2, and 2, right? Now coming on to the bones of the hand. Now coming on to the bones of the hand. So we have already discussed all this. Now coming on to the bones of the hand. Now before coming to this picture, let us just try to draw our own diagram and learn first Then we will come to this picture that is given in the atlas. But as of now, let us first try to learn all the bones of the hand today. In one slide, I will teach you all the bones of the hand in a very crystal clear manner. So please write down bones of the hand. The bones of the hand. Bones of the hand. Now, guys, now remember, guys, that there are okay. Let me assume that this is the thumb side. Okay, this is the thumb side, and this is the little finger side. And you guys are going to comment that which one is lateral and which one is medial. You guys are going to comment in the chat box which one is lateral and which one is medial. Little finger medial hoti hai ya thumb medial hota hai? You guys are going to comment it, because yesterday I have already told you in the normal anatomical position which one is closer to the midline. Which one is closer to the midline? So you decide me and tell me which one is closer to the midline. So yes, Jora, Sabrina, Hina, very good guys. Now let us just try to draw our own diagram. You guys already know the bones of the hand, they are divided into three categories, guys. They are divided into three categories. Yes, I mean three categories. Photo, they are divided into three parts. Okay, so we have, yes, the very first one, that is the carpal bones. The very first one, that is the carpal bones, right? The very first one, that is the carpal bones. Carpal bones. Carpal bones are very small bones. Yes, carpal bones. Now remember, beta, carpal bones are eight in number. The carpal bones are eight in number, right? The four bones are in one row and the four bones are in the other row. So little finger, you already know it is the medial side, and the thumb, it is the lateral wala part. The lateral wala part. So, so yes, we have the eight bones. Yes. Now, guys, try to learn the names along with me. Okay, try to learn the names along with me. So there is a mnemonic. Okay, so carpal bones. Carpal bones. Remember, they are eight in number. They are eight in number. So they are divided into two rows. Okay, out of A and B, you guys are going to tell me, okay, the thumb and little finger is like going upside. So out of A and B, which one is proximal and which one is distal? Use the concept that I have taught you yesterday. Proximal means the first, distal means the second, I mean far away. So you guys are going to tell me out of A and B, which one is the proximal and which one is the distal. We have the proximal row. In the proximal row, we have four bones, right? And in the distal row, we again have the four bones. Yes, A is proximal, Sabrina, very good. B proximal कैसे होगा जरा? See, this is the hand, right? Now there are two rows. In the normal anatomical position, you are going to tell me which one is coming closer to the body first, or which one is coming first in the body, or which one is more near to the center of the body. That is this wala part, the first and the second, right? So A is going to be the proximal and B is going to be the distal. So we have the proximal row and we have the distal row, right? So we have the proximal row. Proximal means which is पास मतलब body के center के पास है, जो पहले आता है, P से पहले, it is coming first, right? So we have the proximal. Yes, we have the proximal and yes. And we have the distal wala part, the distal wala part, right? So remember, beta, in the proximal row, yes, we have four bones, right? We have four bones, and you will remember this by the help of a mnemonic. She looks too pretty. Okay, she looks too pretty. S is scaphoid, L lunate, triquetral, and pisiform. Now this naming, it is from lateral to medial. From lateral to medial. Always start the labeling from the lateral side and then go towards the medial side. So lateral, it is the thumb wala part. It is the thumb wala part. So proximal row, that is the first row, guys. Yes. So this one, it is the scaphoid. Scaphoid. Then we have lunate. Then triquetral. And then pisiform. And then pisiform. So always start the labeling from the thumb side to the little finger, from lateral to medial in the first row, right? Now the distal row, basically it is try to catch her, try to catch her, try to catch her. Now T basically stands for trapezium, trapezium, trapezoid, trapezoid, capitate, hamate, capitate and hamate. So this is trapezium, trapezoid, capitate, and hamate. So she looks too pretty. Try to catch her. Distal row में भी जो labeling है, it is from lateral to medial. Always remember, beta, we are going from thumb to the little finger, from lateral to the medial part, right? So yes. Scaphoid, lunate, triquetral, pisiform, trapezium, trapezoid, capitate, and hamate. Capitate and hamate. So I hope all the 8 bones are done. Done, guys. Right? All the 8 bones are done. Just give me a thumbs up, guys, if all the 8 bones are done. I will ask you. Yes. Sure. Very good. Now, now, remember, guys. Yes. Hmm. Now we have these carpal bones, right? Carpal bones. Carpal bones are done. Carpal bones are done. And carpal bones are 8 in number. Carpal bones are 8 in number. Now coming on to the next wala part, that is the metacarpals, guys. The metacarpals. The metacarpals. Be very clear with the term. And metacarpals are 5 in number. Metacarpals are 5 in number. Metacarpals are 5 in number. So let us just try to draw the metacarpals. See, I'm just drawing the line diagrams to make it more clear to you guys, right? So please try to draw the diagram as simple as you can. You should understand it, okay? Right? So we have, yes. The 5 metacarpals. The 5 metacarpals, and again the labeling will be from the lateral to the medial side. So they are labeled as the first metacarpal, the second metacarpal, the third metacarpal, the fourth metacarpal, and the fifth metacarpal. The fourth metacarpal and the fifth metacarpal. So we are going from lateral to the medial side, beta, har row mein, in every successive part from lateral to the medial side. So we have 5 metacarpals. Just you have to remember this. 5 is done. Now these are nothing but these are the metacarpals, and these are also done. The metacarpals are done. Now coming on to the next one, that is the phalanges. That is the phalanges. Now phalanges are also called as the digits. And remember, we have 14 digits. These digits, which you can see over here. Just see my hand, you can see the digits. Yes, these digits. These digits. So digits are 14 in number. And remember, guys, in the thumb, we have 2 digits. Rest all fingers We have 3 digits. We have 3 digits. Yes. Yes. So these are nothing but these are the digits. These are the digits, and digits are 14 in number. Digits are 14 in number. Navicular basically beta, we will do this in foot part. We will do this in foot part. Yes, it is not present in hand. Right? So 14 digits. Now guys, in the thumb, this one it is called as proximal. I have already told you the one in the body which is coming first, it is called proximal. The other one it is called as distal. The other one it is called as distal. So we have proximal phalanx. Phalanx is one, phalanges is multiple. Okay, proximal digit, right? Distal phalanx, proximal phalanx, distal phalanx. In the forefinger also, proximal, distal, and the middle one it is called as the middle. Okay, proximal, middle, and distal. Proximal, middle, and distal. Proximal, middle, and distal. So remember guys, yes, remember guys, we have proximal phalanx, we have the distal phalanx. Now if I ask you which phalanx is absent in the thumb, which phalanx is absent in the thumb guys, try to comment in the chat box and tell me how many bones of the hand are there in total. Two questions, which phalanx is absent and how many bones are there in one hand? Right. Middle is absent in the thumb. Yes, Mohabbati, very good. Roop Singh Meena, it is the middle one. Osama, Saurav, Sabrina, very good. George Irwala, very good, guys. Hina Kosar, very good. It is the middle one. Now, the bones of the hand, guys, count it and tell me how many. Sabrina says 27. Yes, yes, Sabrina, Roop Singh Meena, very good. It is 27. Okay, it is 27 plus 27. Okay, so the bones of the hand, in one hand we have 27. Okay, I'm writing it over here. Bones of the hand, basically they are, yes, they are 54. That is 27 in right, okay, and 27 in left. 27 in the left. So there are 54 bones of the hand. There are 54 bones of the hand, right? 27 in one hand, 27 in the other hand, and total it is 54. And bones comparatively of this upper limb, guys, 10 we have discussed. 10 plus 54. How many? 10 plus 54. Pectoral girdle and the upper limb will total constitute how many bones, guys? 10, 2 clavicle, 2 scapula, 2 humerus, 2 ulna, 2 radius, 10. And yes, hmm, it is, yes, very good. Gayatri, Sabrina, yes. Saurav, Hina, very good. It is 64. It is 64. So remember, guys, the appendicular skeleton, the pectoral girdle, and the upper limb. Yes, we have total of, yes, 64 bones. 64 bones done. So we have already completed 80 bones and now we have completed 64 bones. Now, can anyone tell me the total number of bones we have, how many we have completed out of 206? Yes. Chalo, chalo. Now coming on to the next one. Yes. Coming on to the next one. Okay. That is guys, you guys can practice this over here. Yes. 146, George. Very good. Now, can anyone tell me which bone is this, guys? Can anyone tell me which bone is this? This is your homework also. You will be marking all the bones in this particular slide, right? Can anyone tell me which bone is this? Hmm. Sabrina says capitate. What about rest, guys? 146 is okay. Jura, very good. Yes, it is the capitate, guys. I already told you, scaphoid. She looks too pretty. try to catch her. Okay, this is capitate, guys. This is capitate. Now, guys, if you are confused, okay, let me tell you one more thing. If you are confused among this bone, this is trapezium, and the next to it, it is the trapezoid. Trapezoid. Now, guys, you already know both are TT. Remember, beta, trapez and trapez. It is common to both the words, right? Then comes I and then O. You already know I comes first in the English alphabet and then O. So always remember trapezium will be the on the lateral side will come first. Then we have trapezoid. Then we have trapezoid, right? Then we have trapezoid, right? So that is okay. Can anyone tell me what is the name of this bone? Yes, this is the thumb, and you guys are going to tell me what is the name of this bone. And this is the little finger. Yes, Mohabbati. Okay. Hmm. Radius. Osama, very good. Saurabh, very good. Ajala, very good, beta. It is the radius bone. It is the radius bone. Yes, Hina, very good. It is the radius bone. Now, Amreen, very good. Very good. It is the radius bone. Now, this is the radius and this is the ulna. Because you already know radius is the lateral and thumb is also the lateral. Thumb के नीचे radius होती है, little finger के नीचे what will be there? That will be the ulna bone, right? Okay, and in the normal anatomical position, the little finger is closer to the midline as compared to the thumb. Gayatri, very good. Now coming on to the next one, that is the appendicular skeleton. And in the appendicular skeleton, we have the pelvic region, right? I have discussed yesterday in the class what is the pelvic region composed of, right? The hip bones, okay, the hip bones, right? And the bones of the lower limb. So guys, over here you can see, over here you can very well see we have the hip bone. We have the hip bone, right? So this is the bone of the pelvic girdle. That is alone. That is the hip bone. And hip bone are basically two in number. They are two in number. One for the right side and one for the left side. We have two hip bones, guys. We have two hip bones. One for the right side and one for the left side. Now, apart from that, guys, this bone, that is the longest bone of the body, longest and strongest bone of the body, this bone, it is called as the femur. It is called as the femur. And femur is also two in number. Okay, one for the right part and one for the left part. And guys, you already know that this region, it is called as the thigh region. It is bone of the thigh region, right? It is the bone of the thigh region. And remember that, yes, this is the longest and strongest bone of the body. Longest and strongest bone of the body. Longest and strongest bone of the body. The longest and strongest bone of the body. Now we have something over here that is present on the inferior part, on the lower part of the femur, and this bone, it is called as the patella. This is called as the patella. Patella, it is also called as the kneecap. Patella, it is also called as the kneecap, and remember patella is two in number. We have the right patellar bone and the left patellar bone, right? Patella, it is called as the kneecap, right? It is two in number, the right and the left. It is present on the lower part of the okay, the lower inferior part of the femur. Okay, so that is the kneecap. Now over here, guys, remember, let us suppose that this is the midline of the body. Let me use some other pen just to show that this is the midline of the body. This is the midline of the body, right? This is the midline of the body, right? This is the midline of the body. Now, guys, you already know that this region was the thigh wala region. This is the thigh wala region, right? And this, it is the leg. It is the leg. Now, in the leg, we have two bones. The one which is closer, the one which is closer to the midline, it is called as the tibia. while as the opposite wala bone, it is called as the fibula. Okay. The one which is closer to the midline, it is the tibia. Yeah, and the fibula is lateral. Very good, guys. The tibia and the fibula. And you guys already know tibia is also 2 in number. The fibula, it is also 2 in number. The tibia also, we have the right tibia and the left tibia. The fibula also, we have the right fibula and we have the left fibula. So remember, guys, the tibia and fibula. The tibia is basically the medial bone of the leg, right? The tibia, it is the medial bone of the leg, and fibula, it is the lateral bone of the leg. Fibula, it is the lateral bone of the leg. Fibula, it is the lateral bone of the leg. And below the leg, we have the foot. Below the leg, we have the foot. I will be teaching the bones of the foot in the next slide, but you guys are now going to count and tell me how many bones we have discussed in this wala part. Pelvic girdle, we have only 2 bones, the hip bones, and rest. How many bones we have discussed on this slide, guys? Count it and tell me. Yes, we have discussed 2 fibula, 2 tibia, 2 patella, 2 femur, and 2 hip bones. How many are they? Yes, sir, Sanju, very good. George Azala, very good. They are 10 in number, guys. They are 10, 10, 10 in number. So we have discussed these 10 bones over here. Yes, Johra, Hina, very good, guys. Now, chalo. Zara Aftab, very good. I hope you guys are learning along with me, right? You are maintaining the notes, right? Yes, so Sanjay is counting also how many sir has brought up till now. Very good. So, chalo. I hope you guys are not tired, right? Please, let's complete the topic, whatever we have discussed for today, right? Please be with me. I'm telling you guys, attending the classes live, it is one of the, no, if people think that they'll watch the video later, I think that is a stupidity, because in the live section, there are more chances of interaction, there are more chances of questioning, there are more chances of learning, there are more chances of asking, right? So, yes. Yes, I will complete it. I'll complete it. Yes. So now coming on to the bones of the foot. Now coming on to the bones of the foot. Bones of the foot. Now, bones of the foot, they are divided into tarsals. They are divided into metatarsals. वहां पे carpals थे, यहाँ पे tarsals हैं. यहाँ पे tarsals हैं. So we have metatarsals and we have phalanges. We have phalanges. Right? We have tarsals, metatarsals, and phalanges. We have. मेरा डैट तो यू काउंट ना जिया. चलो अभी काउंट कर लेंगे, 7 काउंट करेंगे जिया. जस्ट वेट फॉर 5 more minutes then we'll count the all the bones together, right? Now just concentrate over here, guys. Now this view beta, it is the superior view. You're watching the bones of the foot from above, right? Now guys, you guys are going to tell me out of A and B, which side is medial and which side is lateral? Which side is medial and which side is lateral? चल बताओ पहले ये. जोरा says A is medial. A is medial. Again बेटा confusion है तो डायग्राम देख लो. तुम देख लो ये ग्रेड टो वाला जो है, it is coming closer to the midline. So it is medial, whereas the little toe वाला जो है, it is away from the midline. So it is lateral. So it is lateral. We will count it as 1 beta. Mulchand, we will count it as 1. Yes, we will count it as 1. Right, Mulchand? I will teach you dot 3 bones also. Just first focus on the bones of the foot right now. Now the 7 tarsal bones, guys, right? Now we have one bone that is called as the talus, the talus, which is helping in the formation of the ankle joint, guys, which is helping in the formation of ankle joint. We have the talus, right? Below the talus, we have the calcaneum. 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 That is also called as the heel bone. You know, girls wear heels, heel wali sandals. So that calcaneum actually is the heel wala part, right? So it is the heel bone, right? So we have talus, we have calcaneum, we have calcaneum, right? Now, this bone, it is called as the navicular bone. This bone, it is called as the navicular bone. Navicular bone, see, bones of the foot have been, just put a dollar sign over here. This has been asked in the FMG exam multiple number of times. They have given the X-ray and they have simply asked while pointing the arrow, which bone is this? 2 to 3 times, 4 times they have asked. So that is very much important, guys. You have to know which bone it is present where. So that's why I'm taking so much of time. Sometimes the examiner is asking such a silly question, but yet students are not able to answer that because they never study the bones. Right? They have asked multiple number of times. They have given this image, they have given X-rays, they have given, right? So that is you guys have to be very much clear of that the bones should be done accurately. So talus, calcaneum, navicular. So we have the navicular also. Navicular. Now we have three cuneiform bones. Okay, the three cuneiform bones. Again, if this side is medial and this side is lateral. If this side is medial and this side is lateral, guys. Now remember, guys, that yes, this will be the medial cuneiform, this will be the intermediate cuneiform, and this will be the lateral cuneiform. Right? Now, when I say cuneiform, okay, cuneiform, cuneiform. So we have three types of cuneiform. Okay, cuneiform. Now, cuneiform can be medial, it can be intermediate, just based on their position. One which is closer to the midline, it is medial. Okay, one which is away from the midline, lateral, and the in between wala part, it is the intermediate. And we have the lateral cuneiform, medial cuneiform, intermediate cuneiform, and the lateral cuneiform, and the lateral cuneiform. Right? And just on the lateral side, we have the cuboid bone. We have the cuboid bone. Be very much clear with the spellings. We have the cuboid bone, the cuboid bone, right? So just count it one. Okay, we have one, one, one. These three, one, 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 and cuboid it is one. So tarsals are seven in number. Seven in number. Now, how many carpal bones are there? How many carpal bones are there, and how many tarsals are there? So you'll understand the difference. The number is the difference, guys. The number is the difference, guys. So you already know we have eight carpals in one hand, right? And seven tarsals in one foot, right? Yes, seven tarsals in one foot, right? So that is about the tarsals wala bone. Again, we have five metatarsals and 14 phalanges and 14 phalanges, guys, and 14 phalanges, right? You guys are now going to count and tell me how many bones of the foot are there in one foot and in both the foot. Chalo, come on, guys. Tell me. Yes, Saurabh Sanju, right. Bones of the foot. कितने हो गए? Yes, we have 26 in one and 26 in the other. So it is automatically 52. 52. 52, guys. 52. Right? 52. We have 26 bones of the foot in the right foot and 26 in the left foot, and total there are 52 bones of the foot. Total there are 52 bones of the foot. Now you guys are going to tell me 52 plus these 10, how many are there? 62 bones in the lower limb and the pelvic girdle. Lower limb and the pelvic girdle, we have 62 bones. So if you want to, okay, if you want to make a chart over here of the appendicular skeleton, of the appendicular skeleton. Now in the appendicular skeleton, guys, you already know we have 126 bones. We have 126 bones. Now bones of upper limb plus pectoral girdle They are 64. And bones of lower limb plus pelvic girdle, they are 62. Total कर लो 126 आ जाएगा. Total कर लो, it will be 126. Yes, total it will be 126. So I hope all the bones are done up till now. All the bones are done up till now, right? I hope all the bones are done. Just give me a thumbs up in the chat box, guys, if you understand all the 206 bones. All the 206 bones. Hmm. Tina, Sabrina, very good, guys. What about rest? Hmm. Sujal Gupta, yes. Hmm. Shall. Now let us come on to the next topic and the last topic for today. That is the classification of the bones. Yet the class is not over, beta. Just try to be in the class. Let us just complete the small topic as well, because this was the topic for the day as well, right? Please try to complete this topic with me, right? The classification of the bones. The classification of the bones. Now, guys, the bones are classified according to, okay, they are classified according to the position, right? Position in the skeleton. If they are situated in the midline, they are classified as axial. They are classified as appendicular, right? They are classified as axial. They are classified as appendicular skeleton. Okay. They are also classified according to their structure, guys, right? Saurav Sanchu says we can hear you whole day, sir. Okay. You will get bored. I'm telling you. No one likes to listen to me. I don't know why. My voice is so sweet. I mean, but still, no one loves me. Now, they are classified according to the structure. Yeah, they are classified according to their structure. Basically, they are classified as compact bone, right? They are also classified as spongy or cancellous bone, right? Cancellous bone, or they are also called as the spongy bone, right? They are also classified on the basis of the development, right? They are also classified on the basis of development. Now, when I say development, basically it is of two types, and that I have included in the last day of general anatomy, where I will be discussing the ossification wala part. So you have to know that there is intramembranous and intracartilaginous ossification. Okay, intramembranous and intracartilaginous ossification. Intracartilaginous ossification, right? And and the last one that we are going to discuss, it is according to the morphological classification. Yes, everyone loves you, Kelvin. Nice class. Thank you, beta. The morphological classification. Now, this is something that we have to discuss over here right now. This is something that we have to discuss over here. The morphological classification of bones, right? The morphological classification of the bones. So please put the heading as yes. The morphological classification of the bones. Morphological classification of bones. Now, the morphological classification of bones, they are basically divided according to their shapes. They are divided according to their shapes, right? Right? They are divided according to their shapes. And in this, the first category that we are going to discuss, it is the long bones. It is the long bones. It is the long bones, guys. It is the long bone. Now, guys, the long bones. Let us just try to write it. Now we have the site where the long bones are found, right? So they are basically found mainly in the yes, they are mainly found in upper limb and lower limb, upper limb and lower limb, upper limb and lower limb. And guys, you should also know the parts of the long bones. Okay, the parts of the long bones, that is, it contains two ends, right? There are two ends and there is one shaft. I will be teaching the parts day after tomorrow, but as of now, remember they are having two ends and one shaft. Two ends and one shaft. Now, guys, if I just in a short, if I just want to draw this, now this is a long bone, guys. This is a long bone. Now it is having two ends. This is the end of the bone. This is also the end of the bone, and this long part, it is called as the shaft. Shaft is basically the long part of the bone. Shaft is basically the long part of the bone, right? The shaft, it is also called as the diaphysis. The shaft, it is also called as the diaphysis. The two ends are basically called as the epi. Epi मतलब ऊपर, ends पे, ठीक है? Epiphysis. Epiphysis. Yes, yes, you guys are like, yeah, very good, guys. Right? Now, guys, what is so important over here? If I just want to compare, guys, you guys are going to tell me we have the length and we have the breadth. Which is more? Which is more, guys? The length and the breadth. Which is more, guys? So long bones are characterized by, yes, the long bones are characterized by, yes, which is more? Obviously, the length. Physiology, yes, Sabrina, very good. The length is just the more. So remember, guys, the length is more than the breadth. Length is more than the breadth. The length, it is more than the breadth. Now, guys, remember the examples over here. The examples you already know. We have seen humerus, radius, yes, ulna, humerus, radius, ulna, femur, tibia, fibula. These are all long bones. These are all long bones. Yes, yes, yes. Everyone is right. Everyone is right. Apart from that, just remember one bone. See, these all bones are present vertically. These all bones are present vertically. Whereas clavicle is also a long bone. It is also a long bone, or I can say only long bone. Very important questions has been asked in the exam multiple number of times. This is the only long bone which lies horizontally. Very important. Which lies horizontally. Only long bone which lies horizontally, guys. Very important. This has been asked in the exam multiple number of times. And please put a dollar sign over here. Please put a dollar sign over here, right? So yes, that is the only long bone which lies horizontally. Now, there is one category of long bones. There is one category of long bones that I wanted to discuss with you people. Yes, there is one category of long bones that is called as the miniature long bones. The miniature long bones, right? Or I can simply say it as the or short long bones. Short long bones. Short long bones, miniature long bones, or short long bones, right? Now, miniature long bones or short long bones, they are nothing but we have, yes, the examples that you have to pen down over here, guys. We have the metacarpals, and you guys are going to tell me how many metacarpals are there and how many metatarsals are there. I have just shown you, guys. I have just shown you. You just have to First time came here, I followed you everywhere. You are the most loved teacher. Okay, thank you so much. Thank you so much. Yes, we have five metacarpals, beta. Yes, 5 plus 5, right? And 5 metatarsals, right? Yes, yes, yes. Physiology, Jura, Hina. Very good. Perfect. Perfect, guys. So, yes. Now, what is so characterized by this? It is basically having one head, yes, one shaft and a base. Now, this is having one head, one shaft, and one base. So it is having the metacarpals and the metatarsals. I've already told the numbering of the naming, the head, yes, the head, shaft, and the base, right? The head, shaft, and the base. So that is done. The long bones are done. Now moving on to the next category, guys. Moving on to the next category, guys. The second one, that is the short bones. That is the short bones. The short bones. Now, the short bones, the sides. Remember the sides? Now, these short bones, they are found in the hand and foot. Okay? They are found in the hand and foot. In the hand, basically in the form of carpals, the carpal bones, right? And in the foot, we have the tarsals. We have the tarsals. How many carpal bones are there? 8 plus 8, that is 16, and tarsals are 14. 8 for the right and 8 for the left, 7 for the right and 7 for the left. So we have in the hand carpal bones and foot we have tarsal bones, right? If I just want to say, remember the short bones, basically they are small in size, beta. Remember they are very, very small in size. Okay, they are small in size, right? They have no shaft, beta. They have no shaft. They have no shaft. Okay, they have no shaft. Basically, they limit the movement. They try to know resist the compression forces. Okay, where the length is approximately equal to the width. Okay, you can just remember it is like that. Length is almost equal to width. Almost equal to width, right? The length, it is almost equal to the width. Now coming on to the third category, over here, guys, that is the flat bones. That is the flat bones, right? The flat bones. Now, the flat bones basically include three bones as such. You already know the skull bones, right? The skull bones. They include the scapula, the flat shoulder blade, and they include the sternum. They include the sternum. Yes, they'll also come in this category only, right? Hmm. ठीक है the short bones वाला में हाँ now skull bones scapula and sternum now guys now what is the function of the flat bones guys yes what is the function of the flat bones you have to remember the function better the function of the flat bones the sternum guys the sternum you guys already know that the sternum okay or the skull is basically protecting which organs of the body just try to comment in the chat box they are trying to protect which organs of the body the function it is to protect the vital structures of the body to protect the vital structures you already know yes heart visceral ठीक है the lungs okay skull protects the brain as you all already know the protects the brain skull protects the brain right and for example yeah you already know the heart and wala part bhi theek hai and one more function is that they provide broad surfaces they provide broad surfaces for muscular attachments. Very, very important. They provide broad surfaces for muscular attachments. For example, sternum. For example, sternum, guys, right? The sternum will provide attachment to the pectoralis major muscle, right? And all that. So you have to remember they provide broad surfaces for muscular attachment as well, right? Now, coming on to the next category, that is the irregular bones. Coming on to the next category, that is the fourth one, that is the irregular bones. The irregular bones. Now, when I say irregular bones, now where are they found? Where are they found, right? Yes, the side spit are very, very important. They are found in like the hip bones, right? Hip bones, basically they don't have any particular shape, and the vertebra. And the vertebra. The hip bones are basically two, one for the, they are two, one for the right and one for the, yes, one for the left, right? One for the right and one for the left. Hmm? Let's try to, yeah. Vertebrae are basically 26. Hip bones, you already know they are two, one for right and one for left. Yes, everyone is right. Everyone is right, guys. So, now what are the characteristics? If I just want to highlight the characters of this, yes, the characters. So, you already know they have irregular shape. They have irregular shape. Even guys, I will teach you about the spongy bone. So basically these all are composed of spongy bone and they are covered with a very thin layer of compact bone. Okay, they are covered with a very thin shell of compact bone. So you have to remember they are having irregular shape. They are composed of spongy bone covered with a very thin layer of, yes, compact bone. Coming on to the next, yes, they have no definite shape. Yes, they have atypical shape like the vertebra. You guys already know that. Let us suppose this is the vertebra. So this is somewhat like this, right? So I'm just not drawing it. Yeah, coming on to the next category, guys. Yes, the next category over here. Yes, the, yes, the pneumatic bones first. The pneumatic bones first. The pneumatic bones. Now, when I say pneumatic bones, they include skull bones that are present around the nose, right? Skull bones present around the nose, right? So they contain skull bones present around the nose. Plus NT means present around the nose. Okay, present around the nose, basically in the form of paranasal sinuses. Now these pneumatic का मतलब ही क्या होता है? Air. Pneumatic basically means air. So you already know these bones will contain air cavities. Okay, they will contain air cavities. There will be spaces, air spaces will be there, and these are something which is called as the paranasal sinuses. Paranasal sinuses. Sinuses is basically the air cavities that are present. Nasal means the nasal bones, so they are just present around the nose, right? Para, just on the periphery of the nose. Yes, yes. So remember, yeah. So yes, they are present around the nose. So you should know we have the maxilla. Yes, the examples, guys, it is very, very important. Yes, the maxilla, right? The biggest sinus, the biggest sinus is present, right? The biggest sinus, right? We have frontal, okay? Frontal bone hai, we have the frontal sinus over there. Then we have ethmoid, ethmoid and sphenoid and sphenoid. We have all discussed this in the starting of the lecture, right? Maxilla, frontal, ethmoid and sphenoid, ethmoid and sphenoid. Now, what is the function? What is the function, guys? What is the function of this the pneumatic bones? Very, very important. What are the functions of this pneumatic bone? Basically, remember the very first function. They decrease the weight of the skull, right? They decrease the weight of the skull. They decrease the weight of the skull. They decrease the weight of the skull. Obviously, the air filled cavities are there. They will just try to reduce the weight of the skull. right? Apart from that, guys, remember they give resonance to voice. They give resonance to voice, right? Basically means, yeah, the resonance to voice. Yes. Now, guys, along with that, remember they have a very high vascular mucous membrane. Now, when I say vascular mucous membrane, with a very rich blood supply, guys, with a very rich blood supply, now it provides warming to the inspired air. Whenever you are inspiring the air, it will provide some warmth, and that warmth is basically coming due to the rich, what we say, blood supply or the vascular mucous membrane that is there, right? So that is about the pneumatic bones. That is about the pneumatic bones. Coming on to the last one and the most important one, that is the, yes, that is the sesamoid bones. That is the sesamoid bones. So yes, the last one, that is the sixth one, that is the sesamoid bones. Sesamoid bones. Now when I say sesamoid bones, guys, sesamoid bones. Now these sesamoid bones Now, remember, they are nodules of the bones. Okay, they are simply the nodules of the bones or fibrocartilage or fibrocartilage. Okay, sometimes they are mistaken as a fracture, but remember, they are the nodules of the bones or fibrocartilage that develop inside tendons, right? They develop in certain tendons. Okay, they develop in certain tendons. Now, yes, now these, or say in simple language, I can say that these bones are basically developing inside the tendon. Now, what is a tendon, guys? What is a tendon? For example, you guys already know, let us suppose that this is a bone. Let us suppose that this is a bone, right? Now, muscles are not attached directly to the bone. Muscles are not attached directly to the bone. Muscles are attached with the help of tendon. Tendon, and this is muscle. This is muscle. Now, what is the difference between the muscle and the tendon, guys? What is the difference between the muscle and the tendon? Muscles are having the property of contraction. Although the composition of muscles and tendons is almost same, muscles can contract, but tendons do not contract. That is one difference that you have to pen down over here. The muscles have the property of contraction, whereas the tendons do not show the property of contraction. If you make your hand like this in the form of claw, you can see these rod-like structures. These are called as tendons. These are called as tendons. If you can just see over here. So these are tendons. Tendons can be rod-like, they can be ribbon, flat-like structures, and they help in the attachment of muscle to the bone, right? To the bone, right? Now, now guys, remember some now, now they're remember they're closely related to joints also, right? So remember examples firstly. First, the examples that you have to remember over here, guys. Yes, this is called as the patella. This is called as the patella, right? This is called as patella. Now, patella, it is basically embedded in the tendon of, okay, it is example you have to write, very, very important. The first example, it is embedded in the tendon of one muscle, okay? And remember, they are embedded in the tendon of quadriceps muscle. As of now, just remember the name of the muscle. We will be discussing this muscle very soon. So they are embedded in the tendon of quadriceps muscle. Very, very, very important, guys. Very important example. Multiple times it has been asked. Patella. Okay. Patella, it is a sesamoid bone. It is developing in the tendon. And which tendon? It is the tendon of the quadriceps muscle. It is the tendon of the quadriceps muscle. We have another example, guys, that you have to remember. The example number 2, that is the pisiform bone. That is the pisiform bone. Now, can you tell me pisiform bone, it is present where, guys? Pisiform bone, it is present where? I want the answers in the chat box, guys. Pisiform bone, it is present where? चलिए बताइए बताइए जल्दी से, फटाफट. अभी हमने पढ़ा है. She looks too pretty. She looks too pretty. She looks too pretty. चैलेंजेस नहीं है, अभी पढ़ा ना बेटा. देखो, पिसिफॉर्म पढ़ाया था ना अभी। देखो, शी लुक्स टू प्रिटी, ये पिसिफॉर्म रहा, ये पिसिफॉर्म रहा, यस पिसिफॉर्म, यस द कार्पल बोन्स, यस यस यस, कार्पल्स, कार्पल, प्रॉक्सिमल कार्पल, मीडियल साइड वाली, या द लिटिल टॉक टू सॉरो, वेरी गुड हीना, वेरी गुड हीना, नहीं मेटाकार्पल नहीं बेटा, कार्पल होगा, कार्पल होगा, याद करो, नोट्स को याद करो, ठीक है। सो पिसिफॉर्म बेसिकली इट इज एम्बेडेड इन द टेंडन ऑफ, very very important, it is embedded in the tendon of one muscle that is called as flexor carpi ulnaris muscle, flexor carpi ulnaris muscle, it is embedded in the tendon of flexor carpi ulnaris muscle, flexor carpi ulnaris muscle. Now flexor, again understand the term flexor, कल पढ़ाया था मैंने तुम्हें, flexion में help करेगा, carpi, carpi means carpal bone, pisiform is a carpal bone, ulnaris, it is coming from the ulna, right, muscle, flexor carpi ulnaris muscle, right. So just by the name guys, flexor कल समझाया था, flexion, carpi carpals हो गया, ulnaris ulna bone है, right. Try to relate the terms, beta, it is very 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 important, right. So these are two examples, two P's that you have to remember in sesamoid bone, patella and pisiform, patella and pisiform. Now guys, very very important are the functions of these bones, very important are the functions of these bones, functions, very very important. Now guys, you already know that they help to reduce the friction, right, they help to reduce, yes, they help to reduce friction, okay, to which the tendon is subjected, to which the tendon is subjected, they help to reduce the friction to which the tendon is subjected, yes, automatically, yes. Also, not only friction, they also help to reduce pressure to which the tendon is subjected. They also help to reduce the pressure to which the tendon is subjected. Yes, they help to retain, right? They help to retain the blood supply of the tendons, right? They help. बेटा it is by nature, what I tell, tarsal साथ ही होते हैं ना बेटा, पैर में अब एक अलग से कहाँ से लाऊं मैं, ये तो सवाल भगवान जी से पूछो, टार्सल 7 क्यों बनाए और कार्पल 8 क्यों है। गॉड, हाँ जाते जाते भी कुछ कर ही देते हो फनी ना। कोई बात, चलो एनीवेज। So remember, they may alter the direction of the pull of the muscle as well, right? They may alter the direction of the pull of the muscle, or yeah, they may even just, we don't need to write all this, but you have to remember they help to retain the blood supply of the tendons. If it is a long question in an exam, you can write two more functions. They help to retain the blood supply of the tendons, right? And they also alter the direction of the pull of the muscle as well. It acts like an anatomical pulley. Agar suppose if patella would not be there, then all the movements would be so very much difficult. They would try to reduce the shearing force. Okay, so that is why it is very much important. That is why it is very much important. Now, guys, one more important thing: if there is any fracture of this particular bone, clinical part, very very important. Clinical part, yeah, if there is fracture, now this symbol is of fracture guys, this is symbol of fracture. You guys already know if there is fracture, it takes long time to heal, right? It takes, if there is fracture of patella, if there is fracture of patella, it takes more time to heal, it takes more time to heal. Why? Can anyone tell me the reason? It takes more time to heal guys. Why? Because there is no blood supply. Very, very important. No blood supply. They don't have their independent blood supply, guys. Very, very important. They have no blood supply. अगर blood supply कम है तो automatically the time of healing will increase. Okay, it takes more time to heal. There are no blood vessels that are present independently, right? No vascularity is there. Apart from that, guys, one more thing I will teach you tomorrow about that particular term. But remember that there is no medullary cavity as well. There is no medullary cavity as well. There is no medullary cavity as well. There is no periosteum. There is no periosteum as well. Periosteum as well. Every bone, it is covered by a layer. Okay. Osteum means bone. Peri means along the periphery. But these bones are having no periosteum. I will be talking about the structure of the bone tomorrow. Apart from that, there is a cavity in which the bone marrow is there. Every bones are having it, but over here, the patella and pisiform are having no medullary cavity. So I will be talking about the periosteum, about the blood supply tomorrow. I mean the day after tomorrow. Okay. So as of now, we have discussed with the sesamoid bones. We have discussed irregular, pneumatic, flat bones, short bones, long bones. All the classification done. All the appendicular axial skeleton bones are done. So I hope guys you understood today's lecture, and please give me a thumbs up if you have written everything over here. Yeah, if you want to connect to me, please connect to me on the Instagram handle. Yes, it is Abhijit Kumar 7859, right? So I hope you all understood the today's lecture. Thank you for your patience, everyone, for listening me out, for taking out time. Okay. So I personally believe if you listen to me live, if you write along with me live, if you see all the images that I have incorporated, yes, live everything. So it will actually benefit you a lot. We have discussed a major part today. Yes. Thank you so much, Saurav. And please recommend the videos to your friends, right? Please share your feedbacks in the comment section below, right? I would be happier to address it. Any doubts, please, you can leave in the comment section as well or to my Instagram handle, and your feedback is highly appreciated. Thank you. Thank you, guys. God bless you. Good night. God bless you, guys. Good night. Let's sleep now. It's almost 12. Yeah, it's almost 12 now. Chal. Bye.